doesn't work like it used to before. Inflammation, coughing, clogging airways. No known environmental factors. But some races are more likely contractors. Mucus block stocks of the pancreas, which reduces insulin production, prevents enzymes from reaching intestines. Hinder digestive process, can cause some losses. I'm talking malnutrition, poor growth, weight loss, infertility in men, because vas deferens are blocked by mucus. Cystic fibrosis is our main focus. Let's do some more research now.
Hello class, today we will be presenting our genetic disease projects. I know that Lisa will be presenting on cystic fibrosis. First, let's turn on the board and complete our owl Punnett squares. Okay, now who wants to go first? I will. Okay, let's head outside. Okay, so let's build a Punnett square. Alright. Cystic fibrosis is an autosomal recessive disease. I'll represent that allele with this. My mom carries this allele, but does not have CF herself. I will represent the dominant allele with this. My dad also carries, but is not affected. This is common for CF patients' parents. Let's combine their genotypes. As you can see, their kids could be carriers or non-carriers. That's 75% likely, but I am the 25% that got both recessive alleles. It is caused by a mutation on the CFTR gene when 3 base pairs are deleted and mutant protein is missing an amino acid, so it cannot fold right. Mutations on other genes may attribute to why some people have it more severely. As of now, the average life expectancy is 41 years. The white population is most likely to be born with this disease, 1 in every 2,500 and 1 in 3,000 for the general population. 1 in 23 Caucasians carry the recessive allele, and 1 in 31,000 Asian Americans have it. Alright, thanks for watching.
Hi, I'm Dr. Vilker, and today I will be telling you about some treatment options we have available for cystic fibrosis patients. So one of our treatment options, which is a daily treatment usually taken morning and night, is an albuterol inhaler. What it does is that relaxes the airways. There's a vest that you can plug into a machine that really makes it shake, and as it shakes, hypertonic saline is in a nebulizer, and the patient inhales that. The water lubricates the mucus, and pulmazine breaks down the mucus on a DNA level. So after a patient would be done with that treatment, they would usually blow their nose or cough up the mucus. Also, because this mucus clogs the pancreatic system and the digestive process cannot work properly, we have pancreatic enzymes, and those are an antibiotic. There's also an antibiotic that many of our patients take called Zithromax. That is an antibiotic that is an anti-inflammatory for airways. Weight, BMI, and lung function correlate. So if a cystic fibrosis patient is at a very low weight, they may have to go on some sort of feeding tube or a certain pill to gain that weight. That is because on your PFTs, which are your pulmonary function tests, that's how well your lungs do, if you don't weigh enough when you have cystic fibrosis, that can really damage your lungs. A normal person has a PFT of usually around 100, but a CF patient who is at about 25 is available to get a double lung transplant, which is not good. And usually after lung transplants, you still only have about 5 years left to live. So CF can be so mild that you don't even know you have it, and CF can occasionally be so severe that you die. Life expectancy in 1955, before any of these treatments were available, were 5 years. Today, it's 41 years, but I have met people who have CF who are 80 years old. So there are a lot of sites out there on CF. There's a lot of research. There's starts of cures, but the whole problem with a cure is this is a genetic mutation, and you can't really correct the CFTR defect without correcting every gene in the body because it attacks on a cellular level. There is a drug called Orkambi, and that's what this is trying to do, but for right now, it's just a helper when you have the disease and just a treatment available. A cure is difficult because you have to change the genetic makeup of every single cell, and every person's genetic makeup is totally unique. So a cure on its way because there is so much research, but because there are so few people in the United States who have this disease, it's really not worth it for pharmaceutical companies to start on cures. Sure, there are a lot of treatment options that break down mucus and allow patients for their pancreas and their digestive system to work. There's still no cure. And this is a CFTR gene on chromosome 7.